Hello, my name is Kendra Barker. I'm a PGY1 family medicine resident with OMICO at Chickasaw Nation in Ada, Oklahoma. Today, I'll be presenting our quality improvement project titled Health Sprint Derby, a competition to enhance diabetes care in outpatient clinics. Diabetes care requires consistent monitoring to prevent complications such as nephropathy, retinopathy, and diabetic foot wounds. However, adherence to recommended care measures remains suboptimal in many primary care settings due to system level and behavioral barriers. At baseline, Chickasaw Nation clinics averaged about 75% compliance using traditional reminder based approaches. Given this gap, we explored whether a gamified, team based competition could improve engagement and care gap closure. Our aim was to improve diabetes care gap closure across 5 primary care clinics through a 10-week competitive intervention, with the goal of achieving the greatest percent improvement and evaluating sustainability over time. We implemented a 10-week quality improvement initiative called the Diabetes Derby across 5 outpatient clinics. This intervention focused on key diabetes care measures, including hemoglobin A1C testing, nephropathy screening, foot exams, eye exams, and blood pressure control. Each clinic received a list of patients with open care gaps, and each clinic was ranked weekly based on the percentage of those care gaps closed. Clinics had the incentive of not only improving patient care, but also a traveling trophy to showcase their success. To support this intervention, clinics received weekly performance feedback. Patient outreach was conducted through phone reminders by clinic nursing, and provider alerts were found within the electronic medical record. The goal was to combine data transparency with friendly competition to drive engagement. Following the intervention, improvements were observed across all of these care measures. The largest gains were seen in diabetic foot exams, which improved by 11.3%, and eye exams improved by 7%. More modest improvements were seen in blood pressure screening and hemoglobin A1C testing, while nephropathy screening remained consistently high. These findings suggest that the intervention had the greatest improvement on previously underperforming measures, such as the foot exam, which is often overlooked on busy clinic days. At the clinic level, all 5 sites demonstrated improvement in overall diabetes care compliance during the 2023 intervention, with the residency clinic showing the greatest improvement. When examining trends over time, mean compliance increased from approximately 75% pre-intervention to 84% in 2023, with further smaller gains of increasing to 85 to 86% in 2024. This pattern demonstrates a strong initial intervention effect, followed by more modest gains, suggesting a ceiling effect and sustained performance over time. Overall, the Diabetes Derby was associated with broad improvements in diabetes care delivery, particularly in those lower performing measures, such as the foot exams. The combination of competition, feedback, and targeted patient lists appeared to effectively engage clinics and drive behavior change. While gamification and competition may not be sustainable as a long-term strategy, this project highlights the value of focused, time-limited interventions to improve care gap closures. This model could also be applied to other chronic disease populations, such as patients with hypertension, hyperlipidemia, or cardiovascular risk, where tracking metrics like blood pressure control, statin use, or preventative screenings could benefit from similar engagement strategies. Additionally, incorporating targeted patient education during these intervention periods, such as brief counseling on the importance of diabetic eye exams, foot care, and medication adherence, may further improve patient engagement and long-term outcomes. Overall, combining a real-time performance feedback with both provider and patient engagement strategies may help sustain improvements in chronic disease management. The clinics of Chickasaw Nation look forward to our Diabetes Derby each year. Thank you for your time, and I hope you have a great day.